everybody. I'm Jeff Mandak, one of the heart docs up at the Fulton Medical Center. And we'll go to the next slide. Today we're going to talk about what is coronary disease. You guys may have heard this term before on different TV shows or on the news or read about in the newspaper. So we're going to talk about the scope of the problem, how many people it affects, how it develops, what are some of the risk factors, and then we'll also talk about something called sudden death and how coronary disease and sudden death can be kind of linked sometimes but are separate entities other times. Next slide. So the bottom line is, who here is an athletic kind of person who likes sports? Not really competitive when it comes to sports. So unfortunately, when it comes to heart disease, we're number one. We're the number one killer of all Americans. It's like, well, that's not a good thing to be competitive about that. And if you look, we always used to think of heart disease as being a problem of men. But actually, more women die each year of heart disease than men, just on average 10 years later. So this bar shows about 350,000 people die each year men die each year of heart disease, and about a little short of 400,000 women die each year of heart disease. When you take strokes and heart disease added together, it's far greater than all other sources of death. So unfortunately, we're still number one. Next. So there's about 1.5 million heart attacks per year in the U.S., and unfortunately, about a third of people die before they even get to the hospital. And that's why prevention is so important. That's what we're going to talk about today. What can you do? What can you do with your family members to help them decrease the risk of having a heart attack? Next slide. So what are the coronary arteries? Well, just like you have arteries that serve blood flow to your arms and your legs and your brain and everywhere else, the heart muscle is a muscle. And even though the heart muscle, the heart cavity is full of blood, the oxygen and nutrients from the blood inside the heart muscle don't transmit into the heart muscle. It has to come out of the heart and then down these arteries that serve the heart, and they're called the coronary arteries. So this big bag called the heart is full of blood. It pumps the blood out through this pipe, and then the blood goes down these arteries to bring blood flow to the heart muscle itself. And that brings oxygen, nutrients, and gets rid of the waste that the heart muscle produces. If we go to the next slide.
Can't they get clogged?
That's what we're going to talk about. And what happens is, coronary artery disease is the development of hardening of the arteries or blockages in those arteries that provide blood to the heart muscle. So it's not the artery coming out of the heart that gets blocked. It's actually the arteries that serve blood to the heart muscle. And this leads to angina or chest pain, heart attacks, and that can lead to heart failure. So these are some of the terms and how they're related. So the way it starts is when you're born, you have kind of like a Teflon coating to your arteries, just like a Teflon pan. And if anybody here ever cooked eggs, scrambled eggs, you ever use a metal fork on your Teflon and your wife yells at you for doing that? The reason is, what happens when you scratch off the Teflon? What happens?
It comes off.
It sticks. The Teflon comes off, and then the next time you cook eggs, it sticks to that frying pan. Well, that's exactly what happens in the heart arteries, is that first, when you're young, there's an injury or a scratch to that lining of the heart vessel. And that can happen because of high blood pressure, because of genetics, high cholesterol, smoking. Lots of different things can cause that little scratch. And what happens is, once it's scratched, then stuff starts to stick to the lining of the artery. So you get a little bit of plaque. And these little plaques, they can start when you're a little kid, 3 years old. I actually saw, when I was at Children's Hospital in Philadelphia, I saw a baby that had a genetic problem with their cholesterol. When they were born, their cholesterol was over 1,000. And they had plaque already while they were still inside their mother's womb. When they did an ultrasound of the baby, they could see plaque in the heart arteries in utero. So it's never too early to try to prevent this from happening. So this can happen when you're 12, 13, 15, 17 years old. You get a little bit of a plaque. As you get in your 20s and 30s, that plaque can grow. And then when you get in your 40s and 50s, or even later, sometimes that plaque can crack open. And that's when a heart attack happens. So a heart attack doesn't happen because it grows like an onion skin, 20, 30, 40, 50, 60, and then clogs up the artery. It's more of a stepwise fashion. You might have a 40% blockage. All of a sudden that blockage cracks open, and then a clot forms and blocks off the artery within a second. So you can go from a 40% blockage to a 100% blockage in less than a second when that clot forms, and that's what causes the heart attack. You go to the next slide. So the whole key is, you don't want to be calling 911. You don't want to be calling for help when it's too late. And here's somebody, an asteroid's about to hit him in the observatory, and he's calling 911. A little too late. So what we want to do is we want to prevent the heart disease from ever occurring. We want to prevent that asteroid from ever entering our atmosphere. So what can we do to prevent heart disease? And that's really the gut thing of what we're trying to do, is prevent it in the first place. Next slide. So these are all the risk factors for heart disease. And I kind of compare treating heart disease to any 12 steps program. If anybody has any family members or anybody that's in a 12-step program for Alcohol Anonymous, Narcotics Anonymous, Eating Anonymous, anything like that, or Overeaters Anonymous, all those types of things. The first step in recovery or preventing trouble is to realize or admit that you're maybe at risk for disease. Realize that you have a problem. Admit that you have a problem. So what everybody needs to do is ask themselves these questions. These are the things that cause heart disease. Do you have diabetes? Is there a family history of early onset heart disease? Do you have high blood pressure? Do you smoke? Do you have high cholesterol, especially high bad cholesterol or low good cholesterol? Are you older? At male gender, as I said, more women die of heart disease than men, but men get heart disease on average 10 years earlier. Obesity. Do you sit around too much stress? Lipoprotein, little a, and homocysteine. These are substances in the body that can be genetically elevated in certain people, and that can lead to early onset heart disease. So these are things you won't know about right off the bat. Well, all these things are things you can kind of look in the mirror and see. You can look at your family history and see, or you can go to your family doctor and they can say, hey, you know, Joe, your cholesterol is too high, and that type of thing. The ones that have stars, these are the ones that we can do something about. So diabetes, you can try to treat the diabetes and keep it under control, but you can never make the diabetes go away. Family history, we can't change our family, we can't change our age or our gender. Well, I guess you can change your gender if you ask Bruce Jenner. But generally, we don't change our gender. But all these other things that have stars next to them, these are things that when you're 10 years old, 20 years old, 50 years old, that you can attack and decrease your risk.
Frank? I have heard that you can get off diabetes, being diabetic.
Yeah, but you can decrease the risk of diabetes. If you're overweight and you have diabetes and you lose a lot of weight by exercising and watching your diet, you can sometimes get off your medicines. You're still a diabetic, but you sometimes don't have to take the medicines.
Okay.
But you're right, and that's an excellent point, that there are things you can do with diabetes to decrease your risk of that causing trouble. Next slide. So one of the things is smoking. You know, this is called butts are gross. And these are all the butts and then the cigarette butt. So if you smoke or anybody you know smokes, that's one of the biggest risks for heart disease is smoking, because it causes that scratch in the artery that can lead to blockages forming down the road. And this is something that we have power over.
What are you calling about secondhand smoke?
Secondhand smoke increases the risk of heart disease by 25%.
More than the guy that smokes?
No, 25% over somebody who doesn't smoke. But still less than somebody who smokes themselves. So the other thing is, it's important to prove all the different lifestyle areas. So for example, this guy here, anybody recognize him? Anybody a runner here? This guy's name was Jim Fix. And he was a doc back in the 70s or so, and every male in his family died before age 50 of a heart attack. And he decided, you know, I'm not going to fit that bill. I'm going to start running. So he's the one who started. You see all these crazy people running marathons and all that kind of stuff. He's one of the guys who started that running revolution. He died at age 51 of a heart attack. Why? Well, even though he was running, he was still smoking. So the whole key point, and this guy here, you may recognize him. He used to go for runs, but he'd run to McDonald's and get a hamburger, and that wasn't the healthiest thing for him to be eating either. So the thing is, if you have 4 or 5 different risk factors, and 4 or 5 of them are things that we can do something about, you want to attack all 5 areas. If you have high cholesterol, get that down. If you smoke, get rid of the smoking. If you have high blood pressure, get that down. If you have a lot of stress, try to decrease it. Good luck. I think that's a tough one. But anyway, you want to attack all the different areas, because if you just work in one area, but don't work in the other area, then you can still get burned. Next slide, please. So we made a lot of progress in heart disease, but unfortunately, as I said, it's still the #1 killer. And the biggest thing is that 1/3 of patients die before they even get to the hospital. Once you get to the hospital, if you have a heart attack, there's a 95% chance you're going to survive. But a 33% chance that people die before they ever get to the hospital. That's the concern. That's why it's so important to try to prevent it. Next slide. So what is sudden cardiac death? Well, how does that differ from a heart attack? Well, sudden cardiac arrest or sudden cardiac death occurs, or sudden death, occurs when there's an electrical malfunction of the heart. The heart unexpectedly goes into a irregular rhythm where the heart stops pumping. And the #1 rhythm is called ventricular fibrillation. If any of you watch any of those medical shows, ER or Grey's Anatomy, where they might say, oh, he's in VF. ventricular fibrillation. So normally the heart pumps synchronously. You know, every 80 times a minute or whatever it's pumping. Ventricular fibrillation just means the heart just kind of flitters. And that's kind of what this is showing here. The electric just kind of flitters, and it doesn't pump the blood anymore. It's just sort of, the blood just kind of sloshes around inside and doesn't get pumped, and then all the organs die. It's not the same as a heart attack. A heart attack can be a reason to have a sudden cardiac arrest or a sudden death, because the heart attack damage can stress the heart to the point that it goes into this irregular rhythm. But deadly rhythms can happen for other reasons too. Sometimes people are born with genetic problems where it can happen in families. Frank?
Can your coronary heartbeat, can that be hereditary?
Which kind of? Yeah, there are different types of irregular heart rates that are hereditary. There's something called, some atrial fibrillation probably has some genetic component. That's beyond what we understand so far, though. We think that there's a genetic component to a lot of these rhythms, but we don't know it for sure. Some of the muscle disorders that can lead to irregular rhythms are definitely genetic. I don't know if anybody follows, again, a lot of sports people in the crowd, something called hypertrophic cardiomyopathy. When you see these basketball players dying on the basketball court, that's what they're dying from. They have an abnormally thickened heart muscle, and they die because they go into this ventricular fibrillation during their activity. So that's something that can happen. Next slide. So what's the treatment for when somebody has a sudden cardiac arrest? Well, the only effective treatment is to shock them back to life. When we do CPR, by pushing on the chest, and doing the breathing and stuff, that can keep the organs alive for a short period of time by circulating some blood and circulating some oxygen. Generally, the most effective CPR will only work for about 8 minutes at most. After 8 minutes, there's almost always irreversible brain damage where the person won't recover. Now, the only caveat to that is if somebody's out in the cold or frozen in water or drowning in cold water, the cold will actually preserve the body so they may survive for a longer period of time. So, but if it's hot weather and you've been doing CPR for 8, 9, 10 minutes, chances are that patient's probably not going to make it. The only way to get them through it and to get them to survive is to shock them. And that's why you guys may have around this facility, you may see them in churches and schools, these things called defibrillators. Go to the next slide. So the problem is that in emergency medical services, the ambulance can't get there in time. If you have 8 minutes before your heart's irreversibly damaged, and this happens and you live 20 miles from the nearest ambulance, by the time they get to your house, you're going to have died already. So that's why so many people die at home of their heart attacks. Next slide. So the important thing is to try to increase the amount of defibrillators we have and the access to defibrillation. So if we look at 2 cities, anybody ever been to New York City? You know how crowded it gets there and crazy. If there's an ambulance going down the street, nobody even pulls over for the ambulance to get by. So the average response time in New York City for a cardiac arrest is 12 minutes, and their survival rate is 2%. In Seattle, Washington, where they have the most intricate emergency medical service system in the whole country, they have a 7-minute response time, and they have a 30% survival. In general, for every minute that passes after a cardiac arrest, survival drops 10% for each minute. So it kind of fits. 7 minutes, 30%. 70% of people die, 30% of people make it. So that's why it's so important to shock them early. Next slide. So what is an AED? That's an automatic external defibrillator. That's what this is. It's a computerized defibrillator. It looks about the size of a laptop, or even a little smaller in some respects. What you do is, once you hook it up to the patient, we'll show you guys how to do this. Do you guys have them on campus here? Yeah. Mm-hmm. They have them right. So this way, if one of your buddies falls over, you don't have to wait for somebody to come. You'll know how to do it because we'll show you what to do today in the next 5 to 10 minutes. Once you attach it to the patient, it tells you exactly what to do to have it work. And then if it senses a deadly arrhythmia, it will shock the patient back, hopefully returning them back to a surviving rhythm. If they don't have a deadly rhythm, it won't shock them. So you can't hurt somebody with one of these things. It only shocks somebody if they're dead. And once somebody's dead, you can't make them any more dead. You can't hurt them. All you can do is help them. So there's no way you can hurt somebody by using these things. There's a sad story. I don't know if anybody's involved in Little League Baseball. About 5 years ago, there was an episode where a young kid was hit by a batted ball as a pitcher. He was hit in the chest, and he dropped over dead. They had a defibrillator at the field, but everybody was afraid to use it. And it was 18 minutes before the police came and shocked him back, and they restored his heart rhythm, but he has no brain function. So he's living in a nursing home on a feeding tube and a ventilator. And why? I mean, he has no life. So it's really a sad thing. And the defibrillator was there, just people were afraid to use it. Next slide. So the bottom line is, and one of the reasons I'm here is to teach you guys, one, to try to prevent the disease in the first place, both you and your family members, spread the word. Two, if you can get trained in CPR, I'm not sure if you guys have CPR training classes here, that's a good thing to do. And also, just familiarize yourselves with the defibrillator so that you're not afraid of it. Next slide. That's the last one. And you won't shock yourself either. So even if you're touching the person when this happens, you don't want to be touching them when you shock them. You won't die from shocking them. So it's a pretty safe thing to use. And it won't change your hairdo either. So Frank, you're okay there. Next slide. So the bottom one is prevention. Be aware of your risk factors for heart disease and what you can do to try to change those risk factors. Watch for signs of distress. If somebody falls over, call 911. If they wake up and it was just a faint, that's okay. If the ambulance comes and it turns out they were fine, that's okay. It's better to be safe than sorry. Be prepared by learning CPR yourself and using the defibrillator as part of that CPR, basic life support training. So be familiar that way. So the bottom line is we're all at risk for developing heart disease. Our risk level all varies depending on what our risk factors are, as we talked about. All the stuff I do, medical therapy, balloon stenting, that type of stuff, bypass surgery, that's all Band-Aids. The real cure is to prevent the disease in the first place. So if you have kids, if you have grandkids, make sure they don't smoke, make sure they eat right, make sure they exercise to try to prevent it. Because as I said, some of these plaques form when you're 2, 3 years old. You can start forming plaque in your arteries. So you're never too young, nor are you ever too old to try to change these risk factors. So I'll stop there. Any questions about what we talked about so far? And then we'll just have everybody come up and play with the defibrillator a little bit. Any questions at all? Yes, sir.
Yeah, how does diabetes tie in all?
Because the diabetes, I don't think anybody knows for sure, but the high sugars and all that and the other hormones that are elevated in diabetes, including insulin, causes damage. It causes that scratch to the Teflon coating of the artery, and that leads to the progression of the artery disease. Good question. Okay, once you guys gather around, let's kind of play with this. And Frank and Kathy, since I know your 2 names, we'll put you guys on the spot.
Sorry, Kathy.
So basically what you do is, if, say somebody falls over at work, and they're not waking, if they wake up right away, if they're talking to you, that means their heart's pumping. So what you do is, somebody falls over at work, they don't wake up right away. You call 911. The first thing you do is activate the emergency medical services system so they know that they're on their way to come. Then you go say, hey Frank, go get the defibrillator. So Frank goes and gets the defibrillator. Once you open it up, it tells you what to do. So the person who's laying on the ground, you just take off their shirt, you rip their t-shirt, whatever it is. If it's a woman, you don't worry. You're not worried about modesty when they're dead.
Open package and remove
So it goes. So you've got a little package of these patches inside. Open that up.
Peel one pad from plastic.
So this one has 2 patches attached to each form.
Peel one pad from plastic liner. Peel one pad from plastic liner.
Kind of works.
Place one pad on bare upper chest.
So it shows you where to put it.
Place one pad on bare upper chest.
These have been used in quite a time, so they don't stick very well
Place
anywhere.
one pad on bare upper chest. Peel second pad and place on bare lower chest as shown.
So it shows you on here where to put the patches, so you don't have to remember. If it's a small person or a little kid, you can put one in the front and one in the back.
Do not touch patient. Analyzing rhythm.
Now it tells you to take your hands off.
Do not touch
Because
patient.
if you're touching the patient, it might pick up the electricity from your body. So you don't want to touch the patient.
Shock advised.
So when it tells you shock advised, the machine charges.
Stand clear. Push flashing button to deliver shock.
And then when you push the button, it'll shock the patient. This is a fake
It
defibrillator.
is now safe to touch the patient.
And what happens, if the patient wakes up, then you're done. But if they don't wake up, the American Heart Association recommends 2 minutes of CPR, and then you shock them again. So it goes through that whole algorithm.
And it's even telling you.
It's giving you the cadence. So that type of thing. And then you go through 2 minutes of CPR, and then it skips over to the next thing.
Give breath. Give breath. Do not touch patient.
And then it's going to skip to 2 minutes. So after 2 minutes, it says take your hands off, and it checks the patient again to see if they have a rhythm or not.
Shock advised.
And then it's a shock catheter once you push the button. So it's telling you to shock the patient.
Stand clear. Push flashing button to shock
patient
delivered.
jumped, and then goes to the same
It
thing.
is now safe to touch the patient. Start CPR.
And then once the shock's delivered, then it goes
Give
to the
30
CPR.
compressions. Then give 2 breaths.
And you do the CPR again. So it goes through that whole algorithm. So let's stop this. Who wants to do it from start to finish?
Anybody want to try it?
You want to try it?
Better to know how to do it. Sure.
Give breath.
So this is the way there's different types. This is one model. You'll see a Medtronic.